Good morning, everyone. My name is Anand Ulle. So I work as a data scientist in OneCell. So the topic for today is OncoPredict HRD. So we call it as OncoPredict HRD. But essentially, it's trying to identify patterns from the morphology from the whole slide image to predict HRD status directly from H&E-stained images. Okay, so it sounds intriguing based on Anand's talk yesterday. That how are you actually doing it? So the background challenges and motivations are simple. So ideally, everybody is going to precision oncology. Everybody are talking about precision oncology, and we want to understand how deep learning models can be used to identify these subtle morphological patterns, to identify key biomarkers that can help oncologists to take informed decisions. There are some challenges that are there, like it's all known that NGS is really time consuming, it requires tissues, and there's a tumor heterogeneity. So the motivation for us was to identify if there's any morphological changes that can help us identify HRD status. So the study cohort that we used, TCG, so we took two cohorts, one for the breast cancer, the other one for the ovarian cancers. The both had a BRCA1, BRCA2, and we used myriad my choice. Those are the samples that we took. And for the external validation, we took the ovarian, which did not use the myriad my choice. So they had the HRD gene pathways, the BRCA1, BRCA2 mainly, and the other gene pathways. So totally we had around 514 samples. And then how was the workflow? So as everybody has talked about, I don't want to dwell mainly into this. But the stress I just want to make here is the quality. Like, why do we need to check for the quality of image? I mean, my fellow colleagues here talked about it. So there are a lot of things before we actually take those and churn it out. So the first thing what we did was to survey how quality checks are really important. And these are some of the important papers that we referred. So what we did is, if you look at the full slide image, there are a lot of things going on. So if you look at, there are fin markings, there are fatty tissues, there are backgrounds, there are blurry images, and so on. So we built our in-house quality control check. The first thing was to identify tissue regions, to remove all so the red regions, what you're looking at is the tissue regions. The second thing is from there we generated a binary mask. And the next thing was to identify tumor regions out from those binary regions. So we used a Dyno V2, it's a vision transformers, which is basically trained on natural images. But we found many papers that people are using it to automatically classify tumor versus non-tumor. So we used that, leveraged that. We got the tiles from the tissue regions. We passed it out to a Dyno V2 vision transformer. And then there's a little bit of story like why only tumor regions is because we wanted to understand subtle changes in the mitotic figure, the shape and size of the nuclei, which might not be so relevant to a pathologist or looking at from a microscope. So we gave that catch to a AI to look at if there's a small changes which could differentiate or bifurcate between a HRD and a HRD. So inference model is very simple. So what we did is we took a test image, we passed to the same, and the model is going to give us whether it's a HRD or it's a binary classification that we do. These are the results that we have. These are some of the ROC plots, and here are the results that we have. So we have good sensitivity and specificity exclusively for the ovarian cancer patients from the external cohorts that we got. Conclusion, I just want to be short because I know we are running out of time, but I just want to conclude that we have designed an AI model that potentially can pick up these subtle biomarkers that are really important for our HRD predictions. And looking at the higher specificity, we can clearly see that it can be used to rule out patients who do not need kind of therapy like PARP inhibitor therapies. I know that the figures and the result shows impressive. We have 100%, 97%. Everybody are looking for more. But I feel that our model is still not generalizable because we have just looked at only one cohort. We have to look at validating on multiple cohorts. So we are in the process of doing it, and that will be our future directions. So thank you. If you have any questions, I'm here to answer. Sorry, I just took you to a pass because there were a lot of other things that were previously told, so I didn't want to stress more on that.